Amputees. Introduction. The meaning of amputee generally by National Cancer Institute. The removal by surgery of a limb, arm or leg, or other body part because of injury or disease, such as diabetes or cancer. Pran et al., 2021. The above-knee amputation, meaning by National Library of Medicine. Above-knee amputations, involve removing the leg from the body by cutting through both the thigh tissue and femoral bone. Chauvin B.J. and Myers M., 2024. This is Mr. Zach, a 38-year-old man, who was diagnosed with an above-knee amputation after a road accident. He has difficulty doing activities of daily living. Mr. Zach needs to be referred to occupational therapy units to be helped in living his daily life after losing his leg. The occupational therapist will help Mr. Zach in terms of activity of daily living such as transferring, mobility, and dressing, instrumental activities of daily living such as transportation management, home management, shopping, community communication. Evaluation. Patient's name, Zach Arlo. Date birth, April 23, 1987. Gender, male. Age, 38 years old. Status, married. Nationality, Malaysian. Analysis. This is an analysis that has been conducted based on the SOAP note obtained from Mr. Zach. From a subjective point of view, Mr. Zach felt affected because he could not do his daily activities as before. From an objective point of view, Mr. Zach has difficulty balancing his body while standing and walking, which affects ADL and IADL activities. The assessment given by the occupational therapist is to perform exercises or activities that have the potential to improve functional stability while using assistive devices. In addition, OT also provides him with more effective activities for long-term needs so that he can move independently. The challenges encountered by the patient. The patient has difficulty walking independently, less stability to balance the body when sitting and standing. Intervention.
The plan is to improve postural balance and coordination using postural dynamic exercises and improve patients' walking skill using walking frame that is crutches.
The implementation is carrying out postural control trag activity, walking training using walking frame and get trag activity. The postural control trag activity, which is sit to stand activity. Method use is throwing balls into the provided basket. All patients need to follow the steps given. The duration is for 5 minutes. The distance used is 1 meter, 3 meters, and 5 meters. The equipment used are the colorful balls and big basket. Patients will repeat the same technique for stand to sit activity. Based on the first assessment, we found that Mr. Zach was able to use crutches. However, he still needs to do another assessment to improve his walking skills. Then, we decided to do another assessment, which is walking training activity and get trag activity that addressing everyday obstacles. The next is crutch walking practice, that practicing walking on different type of surfaces. Method use is walking with crutch on various type of surfaces. All patients are required to follow the steps given. The duration is for 5 minutes. The distance used is 3 meters, 6 meters, 9 meters. but not least, the Get Trag activity that addressing everyday obstacles. We choose going up and down stairs activity. Method use is going up and down stairs. The steps are given to the patients. The duration is for 3 minutes. The height of the stairs is 20 centimeters, 30 centimeters, and 40 centimeters. Patients repeat the same technique for downstairs activity.
Navigate up and down the stairs while using crutches. Well, you want to keep these two straight, and what I'm meaning is which leg is going to go first up the step versus which leg is going to go down the step first. And to remember that, remember good up and bad down. So whenever a patient is going up the stairs, their good leg is going to go first up on the step, followed by the crutches and the bad leg, which will proceed and go up the step. Now, whenever they're going down the steps, they're going to move the crutches down onto the step. That'll help provide stability, followed by the bad leg, because the bad leg is going to go down, and then they're going to move the good leg down onto the step.
Outcomes. Results of the assessment that has been done on Mr. Zach are successful. Mr. Zach is able to walk stably using a crutches. Activities of daily living, such as walking, not just can be done by Mr. Zach, but he also can do others' activities like bathing and dressing by himself. He showed good progress during rehabilitation, but he needs to continue treatment if have another problem such as involving muscle strengthening. So Mr. Zach still needs to follow up on further treatment to fully recover to avoid any problems in the future.